So this is a little cartoon showing you exactly how the transducer works. As the head comes in, this is the 4.5, it administers these little pulses right to the fascial layers that's required. And then the more superficial transducer, the 3.0, is used to hit the dermal regions. You can see it spares the fat areas. And then as tissue remodeling occurs over the next 4 to 6 months, you see thickening of the dermis and rejuvenation of the dermal tissues and thickening of the deeper connective tissue layers. In this particular patient, you can see that there is some hollowing of the cheeks, some forming of jowling here, and fairly deep nasolabial crease. 5 months after treatment, you can see significant improvement in nasolabial crease. You can see that the cheek is reforming here, and the jawline is much improved. This happens to be one of my patients who really did not like this portion of his neck, so we treated him with dual plane treatment at 3.0 millimeters and 4.5 millimeters, and just 3 days later you can see significant improvement. Another patient with some lack of definition to the jaw, some hollowing of the cheeks, and some prominence to the nasolabial crease. After treatment, 7 months after, you can see that there is softening of the nasolabial crease, there is improvement of the right cheek, and there's better definition to the jawline. Now, in doing plastic surgery for facelifts, one of the areas that's the hardest to treat is this region right here. Because the tissue is undermined using the preauricular source, the plastic surgeon can only get so far down on the cheek. So this is an area that's particularly difficult to treat using this technique. However, if you go ahead and treat this with Ulthera afterwards, you can see quite a bit of improvement with significant toning after Ulthera treatment. Another patient here with lack of definition of the jawline before and significant improvement after dual plane treatment. This is another patient of mine who had some problems again with loss of definition to the jawline, deep nasolabial crease, and some hollowing of the cheeks. 3 months after treatment, you can see the cheek has reformed nicely, there is significant improvement of the jawline definition, and the nasolabial crease is significantly softer. This treatment is usually recommended for patients below the age of 60. However, elderly patients can also have significant improvement. This is a patient of mine who really wanted to do something about her jawline and loss of volume in her cheeks and her nasolabial crease area. 3 months after treatment, you can see the nasolabial crease is significantly improved. There is much improvement along the jawline. And look at her cheek. See how she forms this kind of apple type cheek appearance that is a sign of a youthful patient. You should also note that the epidermal regions have significantly improved compared to the pre-treatment photographs.